Hey guys, it's Nick from smilecliniq. Today I'm just going to go through one of my Invisalign cases I've got on at the moment. This is a bit more of a tricky, complex case because it's not a very straightforward one. So let me show you. So for this case, this patient has what we call a Class 2 Division 2 malocclusion, which basically means that the upper teeth are folding back a little bit like this. So if you have a look at the image here, you can see that these upper teeth here, they're sort of angled back. So doing a case like this, it's not a matter of just sort of pushing them forward, otherwise it looks quite bucktooth. So there's a few things that goes into it. So if you have a look at the photos, the scan here, you can see from here, we want to push the teeth forward. So as at the beginning, the first phase of the Invisalign treatment, push them forward, and then what we want to do is kind of push them in to the mouth more, so they're not sticking out so much, which is what we call intrusion. So if you have a look from the side angle as well, you can see from the side, the teeth are quite folded back here at the front, and if you play it through, you can see that these teeth start tipping forward in the first phase, and then as we get to the middle of the treatment here, they'll start kind of pushing in towards the mouth. With his case, and it's a bit complex, we're also using elastics. So it's an additional auxiliary that we use with Invisalign sometimes when we have difficult movements, difficult positions of the jaw to try and help achieve that nice bite at the end. So for this case, his main concern was that he's got a very deep overbite, which means that his top teeth are covering his bottom teeth. You can't really see his bottom teeth in his picture, you can see a little bit of it. So he wanted to open up the bite and also just unravel the teeth to get them less crowded and just rotate them so they're nice and straight and even. So as with these Invisalign cases, the way it affects patients on a day-to-day basis is one, the appearance. So sometimes people feel quite self-conscious of their appearance, and straightening these teeth and improving the smile can provide a sense of confidence. And also when the teeth are crowded like this, when they're overlapping, it's very hard to clean in between the teeth. So we use our normal like electric toothbrush for example, and then also using floss or these little interdental brushes in between the teeth. But when it comes to overlapping teeth, sometimes it's hard to get in these nooks and crannies. So when we straighten the teeth, it makes it much easier to clean the gums, and therefore in the future you have much better gum health. So this treatment took around 1 year to complete. Sometimes with these trickier cases, we need to do what we call refinements. So these are extra aligners we do at the end of treatment just to get that finesse. And then at the end of treatment, right at the end, we put retainers on the teeth. So the retainers will hold the teeth in their position, because without these, the teeth will move back to their original position. So with this treatment, because there was a lot of movement, we had a lot of attachments on the teeth, which are these little buttons on the teeth, which don't look pink in the mouth, they look the same colour as the teeth. So they blend in nicely, but we have to add them onto the teeth, stick them to the teeth, and at the end of treatment, we take them all off again. In his case, we also had little buttons on the teeth, which he would tie his elastic around and latch it onto another tooth to help move the teeth. And at one point in his treatment, one of these buttons came off, which is quite a normal thing, attachments coming off, buttons coming off, it happens sometimes with Invisalign treatment. It's important to come back like he did straight away, just to stick it back on again, to ensure the teeth are moving in the way you want them to. Because if you notice something comes off, or we notice something comes off at your appointment, we want to put it back on to avoid teeth moving in an unwanted way. So you can see with his plan, at the end of treatment, we managed to open up the bite to get that desired smile that he wanted, and he was super happy to get this result after such a long time over the course of a year. If there's anything that you don't like about your smile, similarly we can get you booked in, get a scan made, get a plan, and have a look at what the options are to try and straighten the teeth, move the teeth to improve the smile. And like I said, with improving the smile, it's not only like a self-confidence thing which makes you feel good, there are also some other benefits, like to clean your teeth more easily because there's not overlapping in the teeth. And some people also stop snacking as well when they have Invisalign treatment. So if you're looking to sort of control your diet, lose some weight, this is another additional benefit, like a side effect of doing Invisalign treatment.